There are a few subjects that can stir up stronger emotions among doctors, scientists, researchers, policymakers, and the public than medical cannabis. Welcome to the GW Healthcast. I'm Dr. Mike Smith, and today's topic, the benefits of medical cannabis. My guest is Dr. Mikhail Kogan. Dr. Kogan is the medical director at the George Washington Center for Integrative Medicine and assistant professor of medicine at the George Washington University School of Medicine and Health Sciences, and is affiliated with the George Washington University Hospital. Dr. Kogan, welcome to the show.
Thank you. Happy to be here.
So, this is a big topic, right? There's a lot of debate about the role of medical cannabis, even some confusion about what is medical cannabis versus, everyday, casual smoking of cannabis. So maybe you can help to kind of clear the confusion for us first. First of all, what's the difference between medical cannabis and what people smoke every day for leisure?
Right. So I think that's a really important question to start out with. Traditionally, there are two ingredients that are most commonly prevalent in the cannabis plant, and that's the THC, or tetrahydrocannabinol, which is what everybody looking for when they're trying to get psychoactive or recreational use, and that's what makes people high. So typically, when you buy a product on the street or in a recreational dispensary, you're going to get a product that has a very high percent of THC. Now, it's even more confusing to say that THC does have a number of medicinal properties, but since we're just answering this first question, THC is primarily for recreational use. And when you're talking about the medical use, THC is probably going to be there, but you're starting to look at other cannabinoids. And the second most common one is what's called CBD, or cannabidiol. And typically, for medical use, we will have some combination of several ingredients, and the two most prominent ones are THC and CBD. And once you start having CBD percent or ratio of CBD to THC, which is how we often talk about medical use, is going up. And then once the ratio reaches certain, say maybe 2-to-1, 4-to-1, no matter how much THC you take, it's very unlikely you're going to have any psychoactive or any high. So, in essence, that's the most important separation. There is also routes of administration. Usually, people smoke cannabis to get high versus when we use it medically. We use it topically, we can use it rectally, we can use it as a sublingual drops, as edibles also. And to some degree, of course, as well in inhalation form, but less smoking, but more vaporized.
Right. So just to kind of summarize for the audience, the medical cannabis is going to have a higher amount of the CBD versus the THC. Versus if you smoke it leisurely, you're going to get more of that THC. So medical cannabis is higher amounts of CBD. Why is that? What is it about CBD? What have we learned recently in the research that makes us think this is a medicinal compound?
Well, I think, let me clarify a couple of things here, because it is very confusing, actually, because as I said, THC does have quite substantial amount of medical utilization as well. It's really the intent of the use. And while, yes, generally speaking, you need some CBD to kind of offset the THC high, but again, THC sometimes alone is used. CBD itself is a pretty potent anti-inflammatory substance. In fact, it's recently, I would probably say some months ago, has been FDA approved as the medication Epidiolex for seizure disorder in certain populations as a complex seizure condition. So there's already official medical use for CBD for at least one condition. And we use it a lot for, again, that's obviously off-label, but we use it for anxiety, we use it for sleep, even topically for pain. I think if I start kind of carefully go through possible list of application, the list will be very long.
Right.
I think it's important to mention also that typically most of us who have some experience in this field will probably utilize multiple cannabinoids at the same time. So we will not use just CBD. We will combine CBD with THC or other ingredients. And also, there's this idea of entourage effect. When you add components that are originally in cannabis at a small amount, but when they combine with a main ingredient, there's somehow potentiation of the effect. That's called an entourage effect. And so you can have a whole extract of the cannabis plant, and it's actually going to be more efficacious than if you just apply, let's say, just CBD alone or just THC alone.
Right.
So I think this is an unusual scenario where both medical plant medicine as well as medications will coexist.
Maybe Dr. Kogan, I think maybe the listening audience might appreciate a little education on the cannabinoids themselves, right? I think a lot of listeners are familiar with, the sympathetic nervous system, the parasympathetic nervous system, cortisol, and the stress response. We hear about all of that a lot, but there's another system in the body, right, called the endocannabinoid system. Can you teach us a little bit about that, and why is that of such interest to physicians like yourself?
Right. Well, it's the oldest system we have, actually. It's a lot older and a lot more prevalent compared to, let's say, endorphin system, which is what we use opiates for, things like morphine. And the system is quite robust. It's present in every cell of our body. There are a couple of different receptors, primarily CB1 and CB2 receptors that we talk. CB1 receptors present in central nervous system, and CB2 in lots of other places. And most importantly, actually, it is a very strong regulator of immune system and also of inflammatory responses. So what we know that cannabinoids, our endogenous cannabinoid, and most common one, what's called an anandamide, has regulatory mechanism to control inflammation, to control and balance our immune system. And you also mentioned hormonal system. What's fascinating, and I don't know why that's made this way, is that we have almost no receptors in the brainstem. And that's what's responsible for a very high level of safety of cannabis. In fact, it hasn't ever been described that anybody died from use of cannabis at any dose. And that's probably because we don't have any breathing suppression, no matter how much cannabis you use. The THC, which is the psychoactive ingredient, is very similar to our endogenous anandamide. So we have an exogenous molecule from plant that can induce a very similar effect that our own anandamide can. And of course, you can take a lot more of it exogenously to produce the high, which normally we don't get from our own endogenous system. So, and then CBD is interestingly, it does not directly affect the receptor. It does, but it doesn't really have a potent effect. It rather modulates or changes the effect of THC, and it exudes its efficacy in some indirect way. And actually, it's not really fully elucidated. So I would say the science of and the cannabinoid system is fascinating. It's very rapidly changing, and we're learning a lot, and yet we still don't have a lot of clinical answers. And that's a cautionary tale, is that there's a lot of hype. People use all kinds of products for all kinds of reasons. There's a lot of different hemp products with the CBD, and there are claims on the internet from anything like a cancer cures and all kinds of condition cures. And there may be cases, but unfortunately, the actual clinical data is lagging, and that's really unfortunate because I think the potential here is quite big. And I hope that our politics are changing, so at least providers can start doing clinical studies.
Right. And you do believe, based on what we see in the preclinical and some of these anecdotal stories, that there is really potential for medical cannabis to be a powerful treatment tool for probably several different types of disorders. Just to kind of summarize here, out of all the different benefits that you believe medical cannabis is potentially helpful for, what's maybe like the top benefit that you think really we need to start studying and developing clinical trials for?
Well, let me first give kind of just a quick summary of, I think, what's already proven. And then let's go into what I feel would be kind of the next level of research and where I think the cannabinoid is going to have a really strong impact. So I think the chronic pain, and this is more specifically things like fibromyalgia, chronic fatigue syndrome, neuropathic pain, those type of hard-to-treat pains. I don't think there's any more research needed. We need research to figure out the dosing, but, the current data is very clear, and 2017 report put out by National Academies of Sciences has been conclusive. So they gave a grade A recommendation for using chronic pain, which literally, I guess, on there, they saying that we should be using it as a prescriber almost as a first line. And I would also say that cancer symptoms, nausea, vomiting, appetite, that's also a very important role, and it's quite conclusive as well. And the third would be a spasticity from different conditions, something like multiple sclerosis or certain bowel disorders that present with a high amount of spasticity and spasms. So that's something like irritable bowel syndrome. And the next the sort of next level of clinical research, I hope, will be in a couple of directions, and they're primarily all inflammatory conditions. So maybe IBD, inflammatory bowel disease, maybe neurodegenerative conditions such as Alzheimer's and Parkinson's. And of course, there's a very large amount of interest among the public of using cannabis as disease-modifying approach for cancer. And that's very controversial. I think there's a lot of potential because if you look at the preclinical animal studies and in vitro studies or in petri dishes, there seems to be a very strong anti-cancer effect. Will that translate to the clinical data in humans? Hard to say. And I would definitely sort of slow down the hype out there to say you really can't use something yet quite, maybe hopefully soon once we have trials going and have results.
Right.
Well, what a fascinating topic, Dr. Kogan. I want to thank you for the work that you're doing, and also thank you for coming on the show today. You're listening to the GW Healthcast. Please visit gwdocs.com to get connected with Dr. Kogan or another provider, or call 1-888-4GW-DOCS to schedule an in-person or virtual appointment. I'm Dr. Mike Smith. Thanks for listening.